Maine saw a staggering increase in overdoses in 2021. The Attorney General's office reports 632 people died from a drug overdose last year, 25% higher than 2020's record high. Advocates for people grappling with addiction say a bill moving through the legislature could help save the lives of people at risk of dying from an overdose.
The proposal would give family members more weight to legally require loved ones to get treatment for substance use disorder. News Center Maine's Vivian Lee has a story from Waterville.
For Colleen Madigan, her younger sister Alana is always on her mind.
Alana was funny. She gave the best gifts. She loved rescue dogs.
Alana died at 54 in January from symptoms related to alcohol withdrawal, a battle that had been going on for 2 years after she was prescribed opiates for severe pain caused by 2 other serious medical problems, including having only 1 kidney.
My sister started drinking again, and it was just like a freight train coming for her.
Alana's family says she was hospitalized 12 different times for alcohol withdrawal. She also suffered from severe depression and PTSD. Colleen, a licensed social worker and state representative, pleaded with doctors for help in securing a bed in a residential treatment program because Alana's medical issues put her at serious risk of death. But that process can't happen without a patient's consent. And it was only right before she died that Alana finally agreed to go to a detox program.
We had been asking for help for so long, and we had finally succeeded in getting that. And it still was too late.
Colleen is sponsoring a bill named for her sister that would give loved ones of people with substance use disorder more legal options. Under Alana's law, family members and guardians could petition a civil court judge to start the process of involuntary treatment on behalf of a person with substance use disorder.
The family can be granted an intervention with someone with expertise and licensure designed to provide that, to get the person to go voluntarily.
Steve Danzig is the executive director of Enzo Recovery. It operates opioid addiction programs in Augusta and Sanford, including medication-assisted recovery residences. He says interventions involving family members, friends, recovery coaches, and licensed professionals, as required by the bill, can have a more than 90% success rate.
The bill that is going to ensure that you do have somebody who understands mental health and SUD, that's on board with that team that's composed to try and assist this person in getting help.
If the patient does not want to go into treatment, that would trigger a substance use disorder evaluation conducted by 2 medical providers, including a physician. Those findings would be reviewed at a hearing before a decision is handed down. Colleen says setting up a legal process for the first time to help families of people struggling with addiction.
Then they can start using the tools you're trying to give them. Is something that would have saved my sister's life.
Could lead to a new path to recovery. In Waterville, Vivian Lee, News Center, Maine.
We reached out to 2 of Maine's largest hospital systems for a comment on the bill. A spokesman from Northern Light Health says officials are currently reviewing the proposal. Elena's Law is expected to have its first hearing next Wednesday at 9 o'clock in the morning before the Judiciary Committee.